Pat McCabe was always destined for a life of service.
Well, my father was in the Navy and my grandfather was in the Army. He was a baker in the Army.
Was there any question that you'd do something else?
No. No. That's what you grew up with.
Pat joined the Royal Australian Navy in 1973, but was medically discharged after a serious car accident left her with skeletal damage in 1978. She has lived with constant pain ever since and relies on daily medication.
There's no recovery really, so it's just something you live with, yeah.
During the pandemic, Pat found herself looking for a new GP. For 2 years, she had no luck finding one with open books who would accept her gold card.
Definitely as rare as sense teeth, yeah.
Pat felt the impact physically and mentally. Her pain got worse. She upped her dose of opioids to cope.
Not having anybody there to help you is the biggest frustration.
The Department of Veterans Affairs disputes there's a problem. A spokesman told the ABC DVA had not seen a decline in the number of health professionals providing treatment to veterans, adding there had been an 8% increase in Canberra GPs accepting veteran cards since 2020. That stands in stark contrast to the experience of John King and many others in the veteran community who have struggled to access the care they need.
It's been like that for a heck of a long time.
He says veterans are also having a hard time finding specialists to treat them.
Now, I know of people, for example, who've been given a list of psychiatrists in the ACT and asked the individual, contact each one and book yourself an appointment. And after 15 phone calls, the books are closed.
The impact, John says, is far-reaching.
It's not just for them, but the families as well. You live with that stress with your partner.
There are two types of veteran healthcare cards. The white card, which offers free treatment for specific health issues, and the gold card, which covers all medical conditions. For every appointment, a GP is paid a rebate of $50, plus the Veterans Access Payment, which is $25 in the ACT, and charging a gap fee is not allowed. Canberra GP Kerry Ost says for too long, the system has run on the goodwill of doctors.
Those DVA rebates have not been keeping pace with the cost of providing the services to the patients, and we are seeing, as a result, fewer GPs taking gold cards for payment and more people sort of, closing their books and withdrawing from servicing veterans.
Finding specialists to refer veterans to is also becoming more difficult. In Dr Ost's mind, the solution is simple: increase the rebates, with the risk to veterans of not doing so too great.
The impact on mental health is significant. Many of our veterans are living with conditions like post-traumatic stress disorder, and for some it's hard enough to reach out. And so when they reach out and the doors are closed, then it is very, very challenging.
The federal government did sweeten the deal in 2023, allocating more than $33 million over 4 years to triple the additional payment doctors pocket for treating veterans. But it's a bitter pill for those still battling to find care. Rosie King, ABC News, Canberra.